Hello, and welcome to part 2 of Purchasers and Payers of Medical Technology. My name is Franziska Merkel, and I am a reimbursement and regulatory specialist for diagnostics within the Small Business Education and Entrepreneurial Development, or SEED office. And I look forward to continuing the conversation with you on who purchases and who pays for medical technology. In part 1, we spent time on the medical technology or device ecosystem and learned about the role of third-party payers and how they influence purchasing decisions. Now here in part 2, we will take a deeper dive into who makes reimbursement decisions and for which patient populations. We will also cover why it is important to understand the U.S. healthcare market as a whole. That includes how and where U.S. healthcare dollars are spent. So let's review the third-party payer categories. In part 1, we covered the different players that fall either into the private or commercial and the public payer categories. We covered employers and so-called non-groups as private payers, and we learned about the Centers for Medicare and Medicaid Services, or CMS, as a public payer, and as well as the military, also a public payer. Today, I wanted to take a deeper dive into which patient populations are covered by each payer and how those eligibility criteria are defined for each. Let's take employers as an example here. In terms of eligibility criteria, any non-disabled adult under 65 and children up to the age of 26 can be covered here. And you may think, why 65? Well, we'll cover that under Medicare. And let's take a look at key decision makers. So here I want to cover two aspects. Employers can opt to either purchase health insurance through the marketplace. That is certainly an option to contract with health insurers. However, when companies are large enough, they may work with benefit consultants and self-insure and create a plan themselves. And that is a group plan. Now, non-groups are dedicated to individuals or small businesses, and in terms of individuals, that would also include near retirees. So here, health insurers serving the small group market and brokers would be key decision makers, especially for small businesses. You may have heard of your neighbor or your friend purchasing a health plan through the marketplace, so that is certainly an example of that as well. And then a marketplace plan can also be obtained through or for CMS. So once you get into the eligibility criteria for Medicare, so age 65 and older, that is also something that is available to individuals as an add-on to other Medicare services. Now let's shift over to public payers, specifically the Centers for Medicare and Medicaid Services. And I wanted to focus on Medicaid and the Children's Health Insurance Program, or CHIP, first. The individuals who are eligible for Medicaid and CHIP include low-income families, pregnant women and children, low-income elderly, and also the blind or disabled. Now, the key decision makers here, that is something interesting because CMS has some oversight of all state Medicaid programs. However, states each run their own program. And then there are the Medicaid insurers who contract with most states to manage Medicaid population health. We already talked about a little bit about Medicare and that individuals age of 65 and older are eligible under that payer. But it also includes adults that are disabled for more than 2 years and those individuals who suffer from end-stage renal disease. The key decision makers here are CMS and specifically the Coverage and Analysis Group, or CAG, and then Medicare Administrative Contractor Medical Directors, as well as health insurance servicing or serving Medicare Advantage market. The military is also a public payer, and here active duty members and their families, as well as veterans, are included in terms of their eligibility to be covered by the military. And the key decision makers here are TRICARE program, and specifically the Defense Department and Veterans Affairs. Here, I wanted to cover to some extent where healthcare dollars are spent and which entity reimburses or pays for healthcare expenses. While these numbers are from 2021, they still hold true today. Now, on the left-hand side, we see that spending can be broken down into these following categories. It entails healthcare or hospital care, physician services, clinical services, prescription drugs, nursing care facilities, home health care, other personal healthcare costs, and it also entails government administration. That includes all administrative costs associated with insuring individuals in health insurance programs. It also entails net cost of health insurance, and that is the difference between what insurers incur in premiums and the amount paid in benefits. This includes administrative costs, additions to reserves, rate credits and dividends, premium taxes and fees, and net underwriting gains or losses. Lastly, government public health activities and investment spending are also part. And when you think about your medical technology, I want you to think about where in this pie chart your medical technology fits in. Would it be used in hospital care? Or would it be a part of a physician service in an outpatient setting? Would it be a clinical service rendered? Or would it be part of potentially home health care or nursing care for the elderly? It plays a role in who reimburses for your medical technology. Lastly, I want you to think about your medical technology and who would likely pay for it or the bill as it states here. So I want you to combine what we learned on the prior slide in terms of who would most likely benefit the most in terms of patient population and eligibility, who would benefit the most from your medical technology. Would it be an individual covered by an employer? Would it be someone who's 65 years or older and most likely be covered by Medicare? So that all you should be taken into consideration when you create your strategy for your medical technology and your reimbursement plan. To recap, in part one of Purchasers and Payers of Medical Technology, we assessed the role of consumers, vendors, and healthcare providers. And in this segment, we primarily focused on third-party payers. And we said that they include private and public payers who provide the insurance plans for specific patient populations. We also focused on the fact that they do not buy medical technology directly from manufacturers, rather that they reimburse hospitals, the healthcare providers, for the services that may include medical technology. So this is all based on a patient's insurance plan. And they also, as a third-party payers, indirectly influence purchasing decisions by hospitals and providers as they reimburse them for prepaid services and products, including medical technology that are part of an episode of care, for instance. It's also important to understand the role patients have, specifically patient populations, as third-party payers make reimbursement decisions for specific patient populations and markets. You can learn more about how prices for medical technology are determined and negotiated in one of our follow-on modules. And if you still have questions after listening to this recording, you can always reach out to us and request a consult with someone from our team.